So a lot of you know that I did travel nursing for a couple of years, and I really enjoyed it. It's an awesome experience and a way to break up the monotony of bedside nursing that you can fall into. So one thing about being a travel nurse is because you switch jobs so frequently, you are constantly being interviewed. And it was something that scared me in the very beginning, but I learned how to master the interview process, and I wanted to share the tips with you about how to prepare yourself for an interview. All right, tip number one is know who's interviewing you. If you get a call from Human Resources and they let you know that you have an interview coming up, it will behoove you to get that person's name, okay? Get that nurse manager's name, because what I do with that information is I'll look that person up. Typically, I'll go to LinkedIn or Google, search the person, and I will be able to get details about them as far as their background, how long they've been in nursing, where they worked in the past, and I will come in there more prepared and more familiar with that person. I mean, because it kind of levels the playing field. They know things about you. They know, where you graduated, your previous work history. Give yourself that same advantage, okay? Second thing is you have to know the hospital's core values. Get on the internet, look up your hospital, look up their beliefs, what they value. Also, be able to intelligently talk about any new accreditations that the hospital has come about. Are they magnet? Are they trying to be magnet? Are they a level 3 trauma center? Are they into big cancer research? Those are things that you can demonstrate, your knowledge in, as well as showing that you are, really investing yourself and connecting yourself with this institution. It will set you far beyond the next candidate who, just is there because the posting was online that they were looking for nurses. Third thing is be prepared to talk about drugs and diseases. If you're interviewing for a position on a progressive care unit or cardiac unit, be able to talk about, if you're a new nurse, be able to talk about your med-surg rotation or patients that you had taken care of in the past. If you have some work experience, be prepared to talk about the post-surgical patients that you've taken care of. Are you familiar with taking care of patients who have just had a CABG or who are being prepped for cardiac catheterization? Those things give you an advantage because it demonstrates that you have experience in caring for patients who may be very routine or regularly seen on this floor that you're interviewing. Also, be prepared to talk about yourself. Not only be prepared to talk about drugs and medications, but be able to describe yourself. Who are you as a person? What things are you interested in? What are your goals in terms of nursing? And let me just say something as a new graduate, never say you want to get into travel nursing or you plan to just be in an employment position for 2 years and then go somewhere else. Nurse managers don't like to hear that, okay? They do not like to hear that you're going to come to their workplace, they're going to train you, give you certifications, invest all this time in you for you to leave and go somewhere else. So please, even if you plan to not be in a place very long, do not say that in your job interview, okay? People are usually looking for long-term commitments, all right? Think about, always have in the top of your brain a time where you were in a difficult situation. Nurse managers want to know how you deal with adversity on the workplace, how you deal with, difficult situations, difficult patients, how do you resolve conflict amongst coworkers. Those things are very common questions. I'm always prepared to talk about difficult situations that I've been in. And as a new nurse, one of the most difficult situations I think is being able to delegate tasks to individuals who are older than you, more seasoned than you, in terms of your nurse's aide or your unlicensed personnel. That's an easy one that I threw out there. And the last thing is know your value. Okay, so what? You're a new nurse, you don't have any experience, but hospitals are looking for you because new nurses tend to be very positive. They tend to bring a breath of fresh air. They tend to give awesome patient care. Also, you guys are more flexible in terms of working night shift, working day shift, working holidays. The seasoned nurses, they kind of get expectations set in, okay? They're not as flexible. They want their day shift. They want their night shift. They want their weekends off. So know your value. You're coming to make the nurse manager's life a little bit more easier. So they're looking for you, okay? Even though you are very expensive to train, but it usually pays off. New nurses are excellent. They become excellent instructors. They become excellent preceptors. You guys have the desire and the energy to really change a unit around. So those are my tips for a wonderful job interview. Good luck job searching, and happy nursing career. Bye.